Hello, everyone, and welcome to the Convo presented by Leadership Indianapolis. I'm Ebony Chappelle, and today I am so happy to be talking with Sherron Rogers of Eskenazi Health. Sherron, how are you doing today?
I'm great.
Great.
Great to see you.
Great to see you too. Happy to be talking with you. So tell us a little bit about your role at Eskenazi and the work that you do, particularly as it pertains to this COVID-19 crisis that we're experiencing.
Yep. Well, in healthcare, whenever there is an emergency, you establish what's called a command center. And a command center really helps to direct the activities of everybody to make sure everybody is aligned and working in lockstep together. It just creates order and roles. Most of the time, command centers are for fairly brief emergency situations. As you know, this has been pretty unique. As of today, our command center has been open for 73 days. So over the past 10 weeks, myself and another senior leader from Eskenazi have rotated leading our command center, where essentially we're directing the activities to make sure we have a coordinated approach across our health system. We've really had to transform the health system over the past couple of months to make sure that we were everything we needed to be to respond to meet the community's needs and to make sure we were serving our patients most effectively. So I'm really proud of the work that we've done to transform ourselves and to meet the community's needs. And then just in terms of being a part of the command center, everybody pulls all of their unique talents together and puts them on the table and jumps right in and starts working together. So it's a really nice experience to be able to work with people under what's really tough circumstances. But it's been a good experience. Under more normal times, I'm Vice President of Strategy and Business Development and Operational Excellence for Eskenazi Health. So essentially, I lead large improvement initiatives that serve, that really expand the way we deliver our services to new areas of the community or add new services across the health system. Really just to make sure we're exactly who we need to be for our community. I lead teams like our call center, social work, our process improvement teams. So as you know, over the past couple of months, everybody's just adjusted to make sure that we are not only continuing kind of the normal day-to-day operations of the hospital and of our primary care and mental health areas, but also making sure we're responding to COVID.
Yeah, and this has been, such an interesting time, for lack of a better word, right now for lots of us, but particularly for those in the healthcare field. I recall when everything, came to a halt, at one point, and certain people were being sent home to work, and then we started having discussions about PPE. I don't think I ever talked about PPE in my life before this happened, and it's like, okay, so
It's amazing that acronym is one people actually know now.
Yeah, it is insane. So I'm sitting at home, like, I'm not a healthcare worker, but I, admire what you all do so much. And I'm like, do they have enough stuff? Like, is this going to be okay? Like, what's going to happen? And then I saw a really cool picture of you on Facebook wearing this mask, and you had on the gown and everything. And then I realized it was being done in collaboration with Stitchworks Indy. So I wanted to learn a little bit more about your collaboration with them.
Well, that was, I love that picture. And really because it highlights the quality of the gowns, and you don't necessarily think of hospital gowns as something cool looking or in a nice color, but the Stitchworks team did just a phenomenal job. That collaboration came about because of some really deep-rooted community connections that already existed. So first, Ted Grain and I were SKL class members, and Ted leads the
And what's
local
your
initiative
class?
support.
What
37.
37.
Yep.
Okay.
Yep. Class 37. And he leads LISC, Local Initiative Support Coalition, and I co-chair one of their main initiatives called Great Places 2020. Ted was really interested in seeing how the community could help support hospitals during this time, just like you mentioned, and like so many were doing. And I just so happened to also have just rolled off the board for Pattern, where I work closely with Paulina, who is also with helping to lead Stitchworks. So I called up Ted said, hey, community wants to get involved. I called up Paulina. We had a quick discussion. For those that know her, she is you pitch an idea and she's right on it, gets it done. That night I ordered so much fabric. I bought out one shop in California and another in Georgia, and then 2 days later had just tons of fabric here, sent it over to Stitchworks, and they got to work. On the more serious side, as our health system was responding to COVID and really increasing the number of patients, our PPE, our days on hand for gowns, got really low. So we were at about 2 to 3 days on hand of gowns, meaning we had enough gowns to last just a couple of days. And because all of the manufacturers across the country were being hit by healthcare systems to get more supplies, it was really, really tough to be able to get anything in that we needed. So we had to think creatively. And I think we were very fortunate that those deep-seated relationships allow you to act more quickly. So with a few quick phone calls and just knowing people throughout the community, everybody was able to really jump on board and get started. What I really love about the Stitchworks collaboration, they were local makers wanting to contribute and give back, but we were also able to put people back to work who may not have otherwise had an opportunity to. So that was really special to me personally, but also to our whole organization. We were really proud to be able to do that. They made us over 1,700 gowns. They are very popular gowns because they're in such great colors. They're really well made. They're washable, reusable, so we're continuing to get a lot of use out of them. And again, we went from that 2 to 3 days on hand to between that and other conservation efforts, we're now up to almost 60 days on hand of gowns. So that gives us a good supply so that we're prepared not only for our patients who we're seeing today, but far into the future. So really special collaboration, really proud of the community, grateful for the community's support. And I'm not sure it could have happened as quickly if we didn't have some of those relationships in place already. So I'm proud that we have a community that's able to act quickly in that way.
Yeah, that is wonderful. And I think that's one of the key takeaways that I'm having from this conversation is the importance of building relationships and maintaining them so that when things do happen, you can reach out to people that you already have this connection with. Also being able to think very creatively about problem solving, I think is another big takeaway from this, which leads me into my last question. What are some of the key leadership lessons that you've learned in your life that have helped you survive and thrive during this time?
I think the first lesson is really an appreciation that everyone has something to contribute, and people really want to contribute. It's really important to recognize people's unique gifts, their talents, and as a leader, it's part of your job is to understand those talents, put people in the right position, and then get out of the way and let them soar. And people really, really want to do their best. They want to participate in times of crisis. It gives people some ownership and just sense of pride that they are giving back. And so just understanding what people's talents are is really so critical. I think the other is also just an appreciation for the period that you are in, and with anytime you're leading people, leading an initiative, anything, you can't be so focused on the end goal that you forget about the human nature and the environment that you're in. And this is a very stressful time. It's a tough time. It's complex. People have a range of emotions and things that they're dealing with and it can change moment to moment sometimes. And I think you have to understand that not only about those that you're working with, but about yourself. This isn't what we would all consider kind of a normal period. And you have to give yourself some grace through that, give other people some grace, and just, really out of respect that people are doing the best that they can. I think that's really important. And then just as you said, relationships matter. And I think in any leadership one-on-one class, people will say that, but really understanding that and taking ownership of that is so important. Success and relationships don't happen just by a series of transactions. It's those deep-seated relationships that you formed over years, or over having tough conversations, over tough times, that really strengthen your ability to work with people, no matter if it is in an easy period or a tough period. And you want to have those in place, not only because it helps you get the job done, but I think it just makes you a better human. You've got those people to call on, not only when you're doing work, but just when you need something. And the number of people who've just reached out to say, excuse me, I'm thinking about you. I don't know what I can do. Is there anything I can do? Or here's a funny joke, or, anything. And then vice versa. Those moments, I think, especially now, matter even more, and you appreciate them even more. So I think this period has kind of given us pause to remember the importance of relationships and remember the unique ways we can create relationships.
Yeah. Wow. That is very, very well stated. I feel like I'm just learning so much right now and soaking it in. So I know that anybody watching this will feel the same. Sherron, thank you again for your time and your wisdom. We appreciate it. And much love and support to you and everybody over at Eskenazi and all of our healthcare systems across the state that are working so hard to keep us safe right now.
Thank you so much. I appreciate you and everything you all are doing to just represent our community and continue to compel our community to move forward. Thank you, Ebony.
Yes, you're very welcome. And thank you all for tuning in to the Convo. Have a great rest of your day and tune in next week for another conversation.